Good afternoon, everyone. Thank you for joining us for our webinar this afternoon on highlights of disability data from the 2018 Prosperity Now Scorecard. My name is Michael Rausch, and I'm the Director of the Real Economic Impact Network at the National Disability Institute, and today I will serve as the moderator for this webinar. Before we get started, we do need to go over our housekeeping tips. So if you're listening to the webinar, the audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. If you accidentally close the panel, you can reopen by going to the Communicate menu at the top of the screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial 1-650-479-3207 and enter meeting code 668-571-684. Please note you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you do not see the captions, you may need to open the Media Viewer panel by selecting the Media Viewer button in the upper right corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like chat, Q&A, and/or participants. For Q&A, use the chat box or Q&A box to send any questions you have during the webinar to me, Michael Rausch, or NDI admin, and we will direct the questions accordingly during the Q&A portion. If you're listening by phone and not logged into the webinar, you may also ask questions by emailing questions to me at mroush@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the National Disability Institute website at www.realeconomicimpact.org. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host NDI admin, or you may also email Katie Achenbach at kauchenbach@ndi-inc.org. Before we get started with our main presentation, for those of you who are new to the National Disability Institute, I would like to share with you a little bit of information about our organization. National Disability Institute envisions a world where people with disabilities have the same opportunities to achieve financial stability and independence as people without disabilities. We are the first national organization committed exclusively to championing economic empowerment, asset development, and financial stability for all persons across the spectrum of disabilities. National Disability Institute affects change through public education, training, technical assistance, and policy development to help the 1 in 3 Americans with disabilities living in poverty take steps towards brighter financial futures. To learn more about the National Disability Institute, please go to www.realeconomicimpact.org. We hope that if you're not already a member or a partnering organization of the Real Economic Impact Network, that you will join us for this national movement on building a better economic future for people with disabilities. The Real Economic Impact Network is an alliance of organizations and individuals dedicated to advancing the economic empowerment of people with disabilities. To learn more about the Real Economic Impact Network, please go to our website at www.realeconomicimpact.org. So with that, today we are very excited to join with Prosperity Now to look further at the new Prosperity Now scorecard and specifically looking at the data that looks specifically at persons with disabilities. Today, we're going to learn more about the scorecard, hear specifics about what the data says around disability, and we will discuss opportunities and how we can use this data to enhance and further advocate for the financial inclusion of people with disabilities. With that, I'd like to introduce our first presenter. Our first presenter is LeBaron Sims, who is a Senior Research Manager at Prosperity Now. As a member of the Applied Research Team, Mr. Sims is one of the leads on the Prosperity Now scorecard, providing data analysis, visualization, and writing support for the initiative. He also provides analysis for Prosperity Now policy and programs teams and for the Assets and Opportunity Network. We're excited to have LeBaron with us today to share with us more information on the Prosperity Now scorecard. So with that, I'm going to turn it over to LeBaron.
The webinar. I'd like to go ahead and get started by talking a little bit about some of the findings from our 2018 Prosperity Now scorecard. So for those of you who are unfamiliar with Prosperity Now as an organization, our mission is to ensure that everybody in our country has a clear path to financial stability, wealth, and prosperity. Prosperity Now is a national organization that's been in existence since the late 1970s. And we work in communities, in states, and at the federal level on programs and policy initiatives, as well as research around how to better link families and communities to policy solutions and to innovative programs to help lift them into upward economic mobility. The Prosperity Now scorecard has been around since the early 2000s and is a policy advocacy and research tool that ranks and grades the 50 states and Washington, D.C. on 105 measures of both outcome and policy. They give a comprehensive view of how United States households are doing with respect to economic empowerment and financial stability. Of these 105 measures, 53 are state-level policy measures, and 62 are outcome measures. In the world of the scorecard, our outcome measures represent topic areas like income poverty, household net worth, liquid asset poverty, uninsured rate, unemployment rate, and educational attainment, among several others. Of these 62 outcome measures, 21 are disaggregated by race and ethnicity, and 14 are disaggregated by disability status. The disability data, or disability status data, is new to the 2018 scorecard. As we've been, again, as the scorecard has been in existence for well over a decade, it is a continually evolving document, and we try to include as many groups as possible, again, to give a clear picture of what the standing is for all U.S. households with respect to financial well-being and access to economic opportunity. So again, to kind of present this comprehensive view, we do take a very, again, holistic view of what it means to achieve financial security. And in doing so, we look at outcome measures in 5 separate and distinct issue areas. These issue areas are financial assets and income, businesses and jobs, homeownership and housing, healthcare, and education. Now, of the outcome measures that we have disaggregated by households and persons with disabilities in the scorecard, we have a fairly representative list of measures in 3 of our issue areas, and then uninsured rates in the healthcare issue area. Now, in financial assets and income, which is our largest issue area, we include income poverty rate, asset poverty, liquid asset poverty, households with 0 net worth, and household net worth. For housing and homeownership, we include homeownership rate, cost-burdened homeowners, and cost-burdened renters. And in education, we include 8th grade math and reading proficiency, high school graduation rate, 4-year college degree attainment, and disconnected youth. And we'll get into a little bit more detail about what some of these measures are as the presentation progresses. Unfortunately, at the moment, we were not able to include the unemployment rate for persons with disability, but in the next iteration of the scorecard and in future research, we will be including that once we're able to access more timely and more useful data on the uninsured rate among persons with a disability. Now, the way that we define disability in the scorecard and in these individual outcome measures, there are a couple of different ways. One, we define people with a disability in certain measures like 4-year college degree attainment and disconnected youth by defining people with a disability as individuals with an ambulatory, cognitive, hearing, vision, self-care, and or independent living difficulty. Again, people within the confines of the scorecard, a person will be counted as having a disability if they have one or more or some combination of the aforementioned disabilities or living difficulties. In the scorecard, we define households with a disability as households in which at least one member is reported as having one of those aforementioned disabilities. For a handful of measures, specifically households with 0 net worth, household net worth, asset poverty, and liquid asset poverty, how the definition for households with a disability is limited to working age members for those households. So again, for those 4 measures, a household will be counted as a household with a disability if one or more working age members is reported as having a disability. So let's get into some of the data. According to the most recent data published in the 2018 scorecard, 1 in 8 people in the United States have a disability, which is to say 12.3% of people of any age. Further, 1 in 4 households have a member with a disability in the United States, or more than 1 in 4 actually, 26.8% of all United States households. And in the scorecard, we look at household income poverty. Now, while it's clear, and Michael mentioned earlier very helpfully, that nearly a third of households with the disability are living in income, or not households, sorry, of individuals with a disability are living in income poverty. The household numbers are fairly significantly different. Now, of all households in the United States, 13.4% are living in income poverty, which is to say living below the poverty line. Of those households, with a disability, nearly 20% are living in income poverty, which is to say nearly 1 in 5 households with a disability have annual household income below the income poverty level. Comparatively speaking, households without a member with a disability, only 11.6 are living below the poverty line. Now, this translates in a very real way to the amount of wealth or household net worth that households with a disability are able to acquire and attain. Nationally, nationally, the median household net worth, which is to say smack in the middle, 50% of households having more and 50% of households having less, median household net worth is $76,708, which is to say that the average United States family, again, this includes all households with and without a member with a disability, the average household holds nearly $77,000 worth of wealth holdings. Now, that number is significantly lower for households with a working age member with a disability. Among households with a working age member with a disability, the median household has only $43,390 in household net worth, which is to say households with adult members with a disability have over $33,000 less in wealth than the national median household. This means that households with an adult member with a disability are at a significant disadvantage in building a safety net. In case of a financial emergency, of being overburdened with medical costs, a job loss, or being able to withstand any of the challenges, the daily challenges that life throws at them. Nationally, 36.8% of households are liquid asset poor, which means that they lack enough savings to subsist at the federal poverty line for 3 months in the absence of income. In 2013, that means that a family of 4 would have less than $6,150 in savings to, again, withstand any financial emergency that they might encounter. So while, again, slightly under 37% of the full household count in the United States is without this safety net, more than half of all households with an adult with a disability are in the same precarious position, which is to say that more than 1 in 2 households with an adult with a disability lack the sufficient safety net to live or really subsist at the poverty line for more than 3 months without income. And this is to say that these households lack not just liquid savings, access to checking account, to retirement account, to savings accounts that would be able to keep them afloat in times of financial crisis. But more generally, they also often lack the ability to transfer those savings or those earnings into long-term wealth, which again inhibits their ability to both remain economically stable but also transition to upward economic mobility. This also has implications on housing security. As we know, households that have lower earnings, which include households with a member with a disability, also many households of color, and households headed by women, it becomes increasingly difficult, again, with lower earnings to both save and find affordable housing, both from an owning perspective and from a rental perspective. Now, while the homeownership rate is slightly higher among households with a disability, that advantage disappears once you correct those estimates for age. Again, given that the majority of, or given that a significant number of households are, of homeowners, sorry, are elderly, and again, as you age, the prevalence or the likelihood of acquiring a disability increases. Once again, homeownership rate is corrected for age, there is actually a significant homeownership gap among the population without an adult with a disability and the population with a member with a disability. So bearing that in mind, it becomes, again, increasingly important that individuals have access to affordable housing options. Among households with a disability, nearly 60% of rental households are cost burdened, meaning that they're paying more than 30% of their monthly income on their rent and associated housing costs. Now, again, as the greater the percentage of monthly income a household is paying on rent, the lower the percentage of income that they're able to apply to other needs for their household, whether it's childcare, whether it's education expenses, whether it's transportation expenses to and from their place of employment. Further, well over 30% of homeowners with a disability, or homeowners or households with a home-owning households with a member with a disability, well over 30%, and actually nearly 40% of them are also cost burdened, again, paying more than 30% of their monthly income on home ownership costs, their mortgage, and associated costs. This is significantly higher than the national average in both categories, and certainly significantly higher than their peers without their peer households without a member with a disability. Again, with the added strain of the added financial strain of higher costs, higher relative costs for housing, this has very real effects on the health and wellness of individuals, particularly within households with a disability. Now, while the uninsured rate is lower for people with a disability than for people without, that is one of the major and significant public policy wins, over the past century, is guaranteeing to some degree access to affordable health care for people with a disability. With that said, a significant percentage of the population is still unable to access affordable health care, and given the policy environment in Washington, D.C. and in many state houses, it is many of these most vulnerable households are certainly at risk of losing their access to affordable health insurance. And we already know that 1 in 5 Hispanic and Latino adults and 1 in 6 African American adults were unable to visit a doctor due to cost in 2016. Nationally, 13% of adults in the United States couldn't see a doctor due to cost or had to skip a doctor visit due to cost. But again, those numbers are significantly higher for people and adults of color. This also has implications on K-12 education. And our education issue areas where we see the most drastic disparities between the total population in the United States and individuals with a disability. As we can see here, in our K-12 education outcome measures, young people with a disability perform significantly worse in 8th grade math proficiency, in 8th grade reading proficiency, and in high school completion or graduation rate. Now, certainly this is not an indictment of these students, but more so an indictment of the way that our education system serves these students. With respect to 8th grade math and reading proficiency, when students with a disability are not attended to and are not given the resources necessary for them to succeed or for them to learn at the are not given the resources necessary or required for them to compete academically or again complete their academic education, it leaves an entire population of young people, of students here in the United States that are unable to achieve and maximize their potential, and thus leaves both their households and their communities at a greater disadvantage in the economy, which again limits their ability to access channels of financial and economic opportunity. Now, post-K through 12 education, again, young people with a disability are at a significant disadvantage as it relates to their performance and ultimately their access to economic opportunity. Among disconnected youth, which is young adults aged 16 to 24 who are neither in school nor working, nearly 30% of young people with a disability are disconnected. Now, this is compared to 10.4% of young people without a disability. Again, having a disability should not limit people and should not limit people's access to long-term financial security and economic opportunity, and certainly upward mobility. But it's become clear that the way that our economy is structured and the way that our public policy decisions have been made continues to hold back young people with a disability and close off access to full economic opportunity. Likewise, among adults with a four-year college degree, nearly 35% of adults age 25 and older have a four-year college degree. This is compared to only 16.7% of young people with a disability. Now, given the K through 12 education statistics that we shared in the previous slide, this is probably not a surprise. That doesn't mean that the United States, and certainly our education system, can't do better by these students. It should become a priority for our lawmakers and our education officials to close this gap and to provide young people with a disability the resources necessary for them to achieve at higher levels. And so what can we do to take action? What can we do to help reverse some of these trends that inhibit the full economic potential of young people with a disability, adults with a disability, and households with a member with a disability? Well, first, you can access all of this data that is available, again, disaggregated by disability status at the Prosperity Now Scorecard website. And to access that, you simply visit scorecard.prosperitynow.org. You can sign up for one of Prosperity Now's multitude of public policy campaigns. We have a number of campaigns at the federal level. We also open up access to other members and other advocates on issues as they relate to household financial stability and capability. You can also visit our events page. We have a number of events happening throughout the year that not just listening sessions with our state and local and our federal policy teams, but technical assistance engagements and events with some of our federal, state, and local partners around the country. You can also contact the scorecard team for a webinar or a presentation where we can do deeper dives into the your policy agendas, your policy priorities, and some of this data both at the federal and state levels and also at the local level. And you can reach us, the scorecard team, by emailing us at scorecard@prosperitynow.org. Further, you can connect with the Prosperity Now community. We have a number of community champions at the state and local levels who are leading in state and local advocacy all around the country. And we have representatives throughout, multiple representatives in many states, and the bulk of the United States. You can access or reach out to your community champions by visiting the scorecard website or by visiting the Prosperity Now website, which is prosperitynow.org, by linking to our community champions map. On our community champions map, you can find contact information for all of our community champions, and you can also not just connect with these advocates, but you can connect to some of their policy priorities, and you can connect to their websites themselves. So please visit scorecard.prosperity.org or prosperitynow.org/connect-with-advocates to find out more about our Prosperity Now community. And again, you can take action with the Prosperity Now campaign. You can sign up to stay informed about the latest developments and opportunities to take action by joining one of our 4 federal policy campaigns around homeownership, around consumer protections, around the safety net, and our Turn It Right Side Up campaign, which serves to reverse the priorities of federal tax policy so that the tax incentives don't go to the richest and most wealthy American households, but to those that could do the most with those tax savings. And in order to take action, please visit prosperitynow.org/advocate. And lastly, you can, again, visit the scorecard website at scorecard.prosperitynow.org and access custom reports and graphics. Again, as we've added the disability data to the scorecard website, we've also included a disability disparity report where you can identify a handful of measures disaggregated by disability and create a custom PDF that presents a handful of bar charts that show you the disparity between households with disabilities and households with people with disabilities and households without a person with a disability. You can use this in messaging. You can also replicate some of these graphics and bar charts in your presentations and in your communications as well. So with that, I'd like to thank you for listening, and I will pass the microphone back to Michael as we continue. But if you have any questions for me or for the scorecard team, please reach out to me directly at lsims, that's LSIMS, at prosperitynow.org. And thank you.
Great. Thank you so much, LeBaron, for sharing this information with us. A lot of great information. We do have a lot of questions that have come in, but we are going to hold the questions until after our next presenter has shared some remarks. So we're very fortunate today to have a very busy person join us on our webinar today. And so our next presenter is Michael Morris, who's the Executive Director of the National Disability Institute. And Michael is going to share with us some responses and thoughts around the scorecard and some of the findings from the data to really look at what are some opportunities for us. So with that, I'd like to turn it over to Michael Morris.
Thanks, Michael. I appreciate being with everyone across the country today and appreciate the new additions to the Prosperity Now Scorecard that brings all of this important data regarding people with disabilities. So let me share with you some of our thoughts at National Disability Institute in response to these findings, which very much complement findings of our own research that we've done over the last 4 to 5 years in cooperation with the FDIC and also with the FINRA Investment Education Foundation. I think what we see here, again, is that the data highlights the disparity between people with and without disabilities in terms of household income, household assets, and cost burdens of housing and challenges faced by limited education. What we know related to people with disabilities and this new research findings, as I said, complementing research we've done over recent years, is that I think many of us in the audience across the country know that people with disabilities are less likely to be employed. We also have learned that they're more likely to be in financial stress. And in recent data, and here again, echoed by data drawn out by Prosperity Now, is there is also financial stress caused by medical costs, and that individuals with disabilities, we have learned, are more likely than people without disabilities to skip medical care because of cost. And get further behind and in debt due to medical expenses that they have incurred. All of this, we know, is tied to poverty and, again, sort of triangular relationships between limited education continuing on to graduating from not graduating from high school, not graduating from college, and not less likely to have advanced degrees, has an impact on limited participation in the labor force, and all of those, again, those two factors are going to lead to households with less income and less assets. You can't address poverty without addressing the issues of financial capability, informed financial decision-making, and access to products in the financial mainstream, products and services that are accessible and affordable. So what do we do about all this? If we go to the next slide, in terms of approaches, we need together, whether you work for a government agency, you're a person with a disability, you're a provider of services, a practitioner in an agency that is working on improving financial decision-making for people with low and moderate income, we know that there's no one way to combat what are these somewhat grim statistics, but we know that changes in policies, changes in structure, the picking up and laying a foundation with financial health and well-being assessments, helping people with disabilities set financial goals, and then growing the availability of financial coaching and or counseling are as an essential and integrated part of social and human service delivery is certainly something that we all can work on together. We can establish and expand collaborations between the financial service sector, including financial institutions and financial service organizations, and disability-related nonprofit organizations. We are in the same communities across the country. whether that be in a city or at a county level, or looking at opportunities to work together statewide. We know that communicating and working together with greater intensity, we can improve the access to and affordability of financial products and services. And we know that, that the availability of safe and stable housing that is affordable also can be done to a greater extent when we work together collaboratively. If we turn to the next slide, what we do know as we look at trying to find an increasing number of pathways to mainstream financial services and products, and the use of banks and credit unions, that we can look at these issues at three different points in time. Access, drawing customers into the financial mainstream to access products and services. Sustainability is once in the financial mainstream, what do we do to keep customers with disabilities there? And then growth, deepening those relationships to achieve financial goals, to help people become savers, to help people build assets and improve financial stability, security, and mobility. Let's look at each of these areas. If we go to the next slide and look at access, we know that over 66% of working age adults with disabilities are relying on public benefits as their major form of income. And we know from our own research are more likely to access alternative financial services. The opportunity must be to look at integration of the provision of financial coaching and counseling, the assessment of financial health within our vast social and human service delivery systems. Whether you're part of the vocational rehabilitation system, the workforce development system, education, a recipient of Medicaid services, home and community-based waivers, what we're not doing, and is only just beginning to start to take place in a few states and needs to be scaled and replicated across the country, is the participation in individual program planning, which is a mandate of these multiple federal funding streams that plays out at a community level and at an individual level, that there be included at the very start an assessment of financial health and well-being, the setting of financial goals, and the provision of support through counseling and coaching to help people achieve those goals. That's going to improve where someone lives. That's going to improve one's financial stability. It's going to even change a person's view related to work. We do know, and we will be talking about, that we know another major barrier for people with disabilities is the arcane rules of public benefits that are means tested, where people literally feel stopped and denied the opportunity to grow assets if they want to hold on to a Social Security benefit or health care, or even when needed, access to food assistance or housing assistance. But we'll talk about ways around that. When we go to the next slide about sustainability, is if we can help people access the financial mainstream, what we need to do is find ways to get people past the fear of losing public benefits and that limits their opportunity to increase wealth, to finding ways to use different strategies and tools that can get around that means testing and sort of life sentence of poverty. Those opportunities begin for people starting in the change of laws in the tax code in 2014 with the opening of ABLE accounts. ABLE, an acronym for Achieving Better Life Experience. 33 states now have ABLE programs, but regardless of where you live, if you are eligible to open an ABLE account, you are not only going to not negatively impact your continued receipt of public benefits, you're also going to be able to become a saver, an asset builder, and those monies, when you pull them out of your ABLE account, are going to allow you to take those monies. The growth will be tax-free. So a great opportunity. We are finally moving to a point of about moving up to almost 20,000 ABLE account owners across the country, but we know close to 8 million people are eligible, so we're at the very beginning stages of people taking advantage of that approach to being in the financial mainstream and improving their financial stability. We know, too, that for financial institutions, they need to be thinking about exceptional customer service by employing more individuals with disabilities and seeking customer feedback to identify improvement, whether that's related to service or the opportunity to purchase or be a recipient of products that meet the needs of people with disabilities. There's more that can be done. And we know, too, that we can involve individuals in transition programs that lead to a positive career pathway. We have to change expectations of professionals and expectations of individuals with disabilities, youth in transition, their parents, to think that there's more to life than that guaranteed receipt of a fixed income Social Security benefit, that there are ways to look to move beyond limited expectations and full participation in the economic and financial mainstream. If we go to the next slide and we look at growth, we know that, as I've spoken in the last few minutes, all of this is not possible unless we integrate financial capability strategies into disability service delivery systems. We need to enhance opportunities to educate diverse partners on the barriers and strategies to enhance financial well-being of people with disabilities, so that we recognize is not the end goal, it's the means to a better, more stable financial life, a life with more choices, a life for an individual with better self-concept and self-confidence, and a more self-determined life with more choices in terms of where one lives, in terms of social and economic participation. It's a very different kind of mindset. We also know that individuals with disabilities should not be left behind in the continued evolution and rapid growth of mobile banking and online supports to grow the relationships with customers with disabilities. And we know, too, that in a modernized view of where regulators take banks and credit unions, but particularly banks in terms of their coverage under the Community Reinvestment Act, that low and moderate income people includes people with disabilities, and that a bank's CRA plan and reporting should include what are you doing in terms of everything from workforce development to financial education to community development that is inclusive of people with disabilities who are disproportionately part of low and moderate income populations in every community across the country. So if we go to the next slide, what we know is there is no one solution. Many of you who are on this call are part of the Real Economic Impact Network, where we regularly hold webinars and continue to provide you information of promising strategies across the country. We know, too, that through the LEAD Center, interpreting and continuing to innovate around implementation of the Workforce Innovation and Opportunity Act, leadcenter.org offers you another place to learn more. And we also know that if you are not participating in an ABLE program across the country, you're missing out on great ways of increasing financial stability and becoming a saver that still keeps the safety net going of different public benefits. And we urge you to take a look at the ablenrc.org, the ABLE National Resource Center, that can help inform your decisions about which state ABLE program you might choose. We know, too, that there are new materials from FDIC in terms of Money Smart. We know that Bank of America has some wonderful materials in Better Money Habits, and Wells Fargo has new materials that specifically relate to people with disabilities as a supplement to the materials they have developed on hands-on banking. What we do know, too, as we've traveled across the country, we have really fine-tuned a wonderful strategy called Financial Inclusion Summits. And there we have brought the banking community together with people with disabilities, sitting together at round tables, thinking about how do we work better together and what are some simple practical steps we can take to grow the availability of financial coaching and financial education to bring people with disabilities into the financial mainstream and away from alternative financial services where they, in fact, can get and grow further in debt. And then finally, and most important, now we are beginning a new phase and a new stage of what is called Empowered Cities, a demonstration project starting in the New York City area, being funded by City Community Development. And we are going to look at how you braid together benefits counseling and planning with financial counseling and coaching. How do we get people with disabilities to take very seriously where they are in terms of assessing their financial health and well-being, setting financial goals, and then really developing their personalized path to a better economic future. So I know with National Disability Institute, we've seen with JPMorgan Chase the support of our FDIC research and of these financial inclusion summits, with Wells Fargo, hands-on banking and new materials with Bank of America as well, Better Money Habits. And so with the big banks, but I don't want to leave out, there's a lot going on as well with regional banks and smaller, even smaller community development banks, as well as credit unions, who I think really recognize that this is no small market sector to overlook. It may take more work in terms of listening. It may take more work in terms of hiring people with disabilities, but there truly is remarkable progress beginning to take place over the last, really, I would say, about 5 years now. And wonderful next stage, I know for us, is looking at the data from Prosperity Now and these report cards, which can be customized down to the state level, and saying, well, there's the challenge. Now, what that represents is the opportunity for us to work together, not in silos, financial institutions by themselves or the disability community alone, but working together to look at what we can do differently. So I hope that all of this kind of research, these new data points from Prosperity Now and some of the reports you can find on our own website, realeconomicimpact.org, will really kind of accelerate your thinking and really galvanize all of us to action. One can't ignore the poverty statistics for people with disabilities, and one can't ignore the lack of knowledge and skill that people with disabilities deserve better to inform their financial decision-making and be a part of the economic and financial mainstream. So you can find our reports, and also I think there's a further slide on some of the new materials with scenarios for financial inclusion from FDIC. And I hope have not taken too much time, and maybe there's a few minutes for questions.
Great. Thank you so much, Michael, for sharing this information with us today. This is great insight in looking at the opportunities and being able to build on those opportunities now that we have this additional data from the Prosperity Now Scorecard. So we do have just a couple minutes, and so I do want to get in a couple questions. We received a lot of questions, and what we'll do is after the webinar, we'll go back and see if our presenters can help us address them, and then we will also place them on our website with the webinar recording. But one question that came in, LeBaron, and I want to direct this to you, is can we consider uninsured as Medicaid recipients?
All of our data that's disaggregated by disability status comes from, or at least the uninsured data comes from the United States Census Bureau. The way that they collect that data are any individual receiving public health insurance or health insurance through a public program like Medicaid, like Medicare, like the Children's Health Insurance Program, actually is counted as having health insurance. So our count of uninsured means that individuals do not have either private or public health insurance.
Okay, and we have time for one more question, and this is also to you, LeBaron, is do you see any differences when you look at the state level data? Are there some states that are doing better than others?
And that is a great question. And that's a question that we really do dive into in the scorecard. So I do recommend that you check, everybody listening, check out the scorecard, both the report and the scorecard website. Now, generally speaking, there's very significant differences and there's significant variability between the national numbers and the state level numbers. And that goes for every data measure that's really in the scorecard. We do see certain regions, the Deep South in particular, where there are higher rates of individuals with a disability and worse outcomes for households with a disability. Now that said, the obstacles that households and individuals with a disability face are significant in every state across the country. And the relative performance of one state doesn't necessarily, the relative high performance of one state, I should say, or one region doesn't preclude or shouldn't distract from the fact that the challenges that people with a disability are facing in their day-to-day lives is very real and very significant.
All right, great.
Yeah. Michael, if you have 10 seconds, let me try just to add to that. We do know from the demographics of the, across state lines in the country, there is greater poverty in the southern region of the country. Southern region of the country, state governments spend less on human and social services. As a result, they often get a better cost share on Medicaid. But the reality of poverty and people with disabilities is not limited to the southern region, and the disparities across the different data points is glaring, whether you're in California, New York, or Midwest or southern states. So there is, regardless of where you live, the issues of poverty reduction, shared prosperity, and really creating this new level of thinking and new level of expectation for people with disabilities that they want to work. They also, with the possibilities of ABLE accounts, many people will be able to save and grow household assets that never would have been able to do before.
Yeah, that's absolutely true, and thank you for bringing that up, Michael. And it's also why advocacy efforts like national disability institutes are so important because the decisions that are ultimately made that affect the day-to-day lives of individuals are made at the State House and, again, by our federal government. And so, again, the advocacy efforts around making sure that people with a disability, children with a disability, have direct access to the resources and services that they need and maintain that access, again, to the drivers of financial stability and upward economic mobility, is paramount.
Great. Excellent. Well, I want to thank you both so much. Thank you to LeBaron Sims for sharing this information. And LeBaron, thank you to your team, to Casey as well, who reached out, and we've been talking about this. And we are very grateful to the Prosperity Now Scorecard team for bringing the inclusion of the disability data into the new scorecard. And thank you to Michael Morris as well for sharing the insight and perspective and for starting the National Disability Institute to bring that awareness and advocacy work.
Michael, I know we're just about out of time. Can I just throw in one more point?
Okay.
If people are still listening, I'm sorry. I know. I guess my prerogative as director. But and it's a plug for Prosperity Now's project on the disparity in wealth between white and Black Americans. But I was reading an article this Monday, which and this is really sobering statistics. From the early 1960s to 2016, Black wealth in this country climbed from $2,600 to $17,400, while wealth among whites climbed from $47,000 to $171,000. So the disparity is not just between people with and without disabilities, but think about people with disabilities who are also Black, who are also women, and also may be further burdened by where they live in this country in terms of the nature of social and human service supports. So although there's so many ways to look at statistics, disability we talk about in a general sense, but I know in our own data, and I'm sure in the Prosperity Now data too, if you dig deeper, you have this further disparity between men and women, Blacks and whites, and at the bottom of that ladder are individuals defined by gender, race, and disability.
Great. Thank you, Michael, for bringing that point up. We really appreciate it. So I want to remind everyone that on April 11th at 3 p.m., we'll be having our webinar and collaborating with FDIC, where they'll be coming and talking about Money Smart and the new disability supplemental materials that Michael had referenced earlier. But we'll also be talking about how our networks can connect with and partner with at the local and regional levels with FDIC in the variety of activities that they are doing. So I hope you will join us on Wednesday, April 11th. Before we close out, I'd just like to give a shout out and a thank you to my colleagues who helped put all of this together, Katie Achenbach, Maggie Redden, with our communications team. We greatly appreciate all of the support that you all do, as well as to the entire training and technical assistance team at the National Disability Institute. If you have questions after the webinar, you can send them to ask@ndi-inc.org, and we will be sure to address those. So thank you again to Prosperity Now for joining us today and for sharing this information. We hope everybody has a great day. Thank you.